Hi, Lori and Amy. Thank you so much for joining me.
Thank you, Marianne, for having me.
Yes, we were looking forward to this.
So tell me, how long have you both been in the positions you're in?
Well, I'll start. I am going to be in this job 4.5 years, and I am counting the days, I think. I don't know about you, Amy, but
Oh,
the
mine is,
last year has really made that
Yeah.
more of an accomplishment. So 4.5 years as the CEO, and I've been at AtlantiCare, hard to believe, 37 years. So I
Wow.
actually worked other places before I came here.
and I'm at week 10. So I,
What a 10 weeks it's been.
yeah, my timing might be off, but I think that, I've had people like Lori who have been tremendously supportive and all of the CEOs in the Southern region. And it's really, the 10 weeks have flown by quickly. So, and before that, I spent 17 years at the RWJ Barnabas system, CEO of Children Specialized for 13 of those years, and then the last 5 years since the merger of those two systems in a variety of corporate roles.
Okay. All right. So let's talk about COVID. How difficult has it been? Tell me some of the issues that you've had to deal with.
Every aspect. I mean, we've been open the entire time. So, when the shutdown came, we, had to manage with trying to get a lot of our employees that could go home and working from home. But the majority of what we do is patient care. So, the majority of our staffs were coming in every day. I don't know, Amy, you were involved up north. I will always, get down and honor all of my northern colleagues and central colleagues because they had a terrible time. The surge was just awful, and congratulations for getting through it. But we will always be proud of all of what you accomplished.
Well, thank you, Laura. I mean, the magnitude of what staff had to go through day in and day out. One of the nurses who has been on shift for 40 years, she's seen it all, done it all. Like, there's nothing that could rattle her. She said, I've never seen so much death in 2 days that I've seen in my entire 40-year career. And I think that it's hard for people to understand the magnitude of that impact. Usually when we're privileged enough to be at the end of somebody's life, there's family around, you've gotten to know them, you've gotten to care for them. We provide that supporting role. But when you're literally the person who's being that conduit for all of the emotions from the family to make sure that somebody is there with them at that last moment of life, it is a huge responsibility and just when you start to think that this might have been one of 6 patients they were caring for, and then they still had to go back and do it again, I think that toll is one that I worry about, just like I worry about the impact on our children and our businesses of being shut down as well, because it's significant.
So was there a specific moment when it hit you how bad the crisis was?
Well, I want you to come down the Parkway. You went to work, I'm sure. I don't know. I want to hear what you say, Amy. I'll follow up.
When we ran out of morgue space and we had trailers and we ran out of trailers and there was literally nothing else to be done. I mean, it was just, that's when it was like it was awful. It was just awful. And, the community came together, right? We had funeral homes, we had crematories, we were doing all these things. We were, literally sending, God forgive me, but sending bodies to be processed in Pennsylvania because we had literally no more room. I mean, it was just the most, like you had immersed yourself so much in the stuff, right? How do we get the PPE? How do we make sure we communicate this? How do we get to this protocol, that protocol? And then in that moment in time when you realized, oh my goodness, right? Like, oh, and again, there was the state right there with us. Okay, this is a solution we have. Here's where we're going to stand it up. I just need you to get through these period. These are the people you need to talk to. It was that whole Office of Emergency Management. And again, I don't think people have any concept of just how complicated that is and how many levels you have to get through and medical examiners and how they, again, stepped up and like every piece of the puzzle. So,
and I would just pales in comparison, but we watched the virus, as I said earlier, kind of come down the Parkway. And I was having calls with the CEOs here on the coast, and just hanging on every word, talking to some of our colleagues up north, and getting ready, and the anxiety of like watching the cases grow and grow and grow.
Yeah. So what would you say for your job? What's been the toughest part in handling the crisis?
just the fact that we didn't have a playbook as we got started, and nobody wants to change a protocol. Like, we really like to have best practices. So early on in the early innings, it was, do this, no, don't do that, change that. And just that the chaos that created, I think, was the hardest thing for me, because what we want to do is, we want to lead through this and want to make sure that we have as minimal interruptions as far as what makes sense to keep everybody safe. And not that they were, not that it was so many different things, but there were enough that in those early innings, it was so challenging. And, it started even with, who should wear a surgical mask and who shouldn't, and what should we do about an N95? But to Amy's point, the challenges that we all see every day, our staff are tired, they're sick of it, but they can't stop. I mean, and, to attribute to them is, this is what we signed up for. This is what we, dedicated our lives and our careers to, but it has been a grind. And as you mentioned, Amy, the suffering and the lack of family has taken its toll on all of us.
Yeah. I would agree completely, Marianne, and I just would add one other little piece of it. Lori touched on it, but we are that emotional bellwether for our staff, right? And so no matter how much crazy is going on, we need to be strong and be there and be present, but also be authentic. Like, if you don't know, you need to say, I have no idea. Like, I can't tell you when this is going to come out. I don't know when we're going to get our next shipment. I don't know, how we're going to best support our employees, our employers in our communities who are, literally not being able to make their own payroll. And I think that, it's not just the healthcare worker that you're concerned about, it's their entire family, because that impacts everybody. And it's overwhelming to think about, this health, generally they're a large majority of women, obviously, in healthcare. So the woman is coming here as the mom and the wife and the sister and everything else. And, her husband or her spouse may be out of work and may be, really worried about all those things. And she's got to turn that off and get on that floor and do all she needs to do. And and you're trying to figure out how best to support through that. And in some cases, just being present is the only thing you can do.
Yeah. Yeah.
I would say just the thing that's great about healthcare is the team sport. Mm-hmm. And I mean, many of our darkest shifts, days, patient moments, it's because we're together, we get through it. And I'd say that was when you agree, Amy, that was sort of the shining light. Like, even on the really dark days, it was like, well, we just have to keep going, and together we're going to figure this out. And
I agree, Lauren. I think that probably goes to the heart of where we are today, which is, we're not all going to get through this, no matter how much PPE we have, no matter how much anything else, if we don't have staff to take care of people. And we're not going to have staff if this community spread continues at the rate it's going. So I know we're all tired, but we need to hunker down even greater, because we want to be here in the full way that we can be here, and we can't do it without staff.
We've had, one of our challenges is, you can imagine being in the fray of all this. And when you get in your break room, you just want to rip off all your stuff and you want to almost lay down. And, we had to really get a lot tighter with how we were all eating together and breaking. So,
well, and we've done so well, right? I mean, everybody got through, and, but that co-mingling and Marianne, I know nobody wants to hear this, but Thanksgiving, Hanukkah, Christmas, you need to stay within your own little bubble, as painful as it is. And it's because the reality is, you don't want to be a statistic, right? And maybe you'll be fine, but it's that person that you connect with, your mother, your father, your grandmother, grandfather. That's the thing that I think would be so unbearable to live with, that, it's just, we just have to, really make sure that we're paying attention to all those things. Social distance, wear your mask, wash your hands, all that stuff. It does matter. It is the only force we have right now to stop the spread.
How frustrating is it when you know that there are a lot of people who are just done and they're not doing that?
I get it. We're done too. we're no less done than they are. But, we see the impact on their potential, their loved ones, and on the people and our team members who are, willingly coming in every single day doing it again. And while we talk about the healthcare workers, I would be remiss if I didn't talk about the environmental services staff and the dietary staff and the facilities people, all who have put themselves at such great risk. And, when you think about the fact that you can actually change this just by how you manage this. One of my docs told me last week, she's still arguing with her patients about whether or not the mask even works or is really necessary, or the whole virus is, and imagine somebody who's been on the front line every single day since March, still having this same conversation, how frustrating it is. But that's where we are. And, this is not the first time as healthcare professionals we've been in these situations, right? I mean, if I eat that pizza, it really is going to be bad for me. Can I do that and just exercise more? No, I mean, that's what we do. But obviously this is much more severe, and having these, having forums like you're providing us to have these conversations are critical.
I think I would just underscore the self-care, the recognition of self-care. And that's for women, I think, and a working mom, it's almost hard to even put it together with, my life, but I really would re-emphasize how incredibly important it is. And we, with so many fun things taken away from our lives, we actually do have a little bit more time. So whether that's the walk around the block, I got back in the pool and I'm swimming is what I do, ride my bike.
Mm-hmm. How has the crisis changed your jobs? And do you think the change is permanent?
Well, we do use a lot more technology like this. I don't know that I would have known how to do a Zoom call, right? Back in February, never did one. So there's some of that. I think how I try, it's sort of the things that we have to get up in the morning, like what I do, like in the first hour, sort of checking where we are, checking where the local hospitals are, assessing kind of what happened the night before, how many discharges, how many in. We go through, at least I do, sort of a rapid assessment of where we are as a system. And then, when things, which is happening now, as things get more complicated, it just takes more time, more of our personal time to be engaged and involved. And then how to balance that with all the other things that you have to do to run a big business. Mm-hmm. We have thousands of employees, hundreds of sites, right now I'm finishing our budget for, I'm working on a plan, a budget. So some of that traditional stuff you just have to keep going with. Yeah. And some of it, I know in the midst of it, it was like, we just were dying to do something other than just COVID, well, can we think about something other than COVID? But when it got really, really dark, that's all we did. At least I know that's all you did, right? I mean, you tried to have something that was normal, what used to be normal, but in the tough days, there wasn't much time for that.
Yeah, I would say that the amount of communication that is required and the amount of what I'll call shoe leather that needs to happen is much more significant and much more important, right? Staff need to see you, right? They need to, so we've gone to this town hall format. And like Lori said, people are hanging on your every word. And they're looking for those glimmers of hope, but they also, they want you to be honest. They want you to be authentic. They don't want to be lied to. They want to understand what, where we are, why we're doing the things we're doing. The why is critically important. So, Lori mentioned, right? Break rooms. It's a sacrosanct. It's the only place you can go. And now I've got plexiglass and door signs that say only 2 people at a time, and I can't even get to the ladies' room, and now you're telling me I can't even have that moment to myself. And trying to reinforce and reaffirm to people, this is temporary. We're going to get through this. We're even if it let's say we get to a vaccine, and let's say that this is something that becomes like the flu and it's seasonal. We can manage the flu, right? I'm sure at the first wave of the flu, it wiped everybody out, but we now have learned, and we're learning much more quickly. I mean, we're not talking about one vaccine, we're talking about multiple vaccines, and we now know a whole lot more than we did in March. So just that constant, I heard one of my colleagues say that she's become, instead of the chief executive officer, she's become the chief cheerleader, right? She's on the floor, she's talking all the time, she's doing those things because people need to see that you're there, right? That's a big thing. They don't want you dialing in. They want to see that you're there. They're there. They want to see you there. And B, that they want to know that you believe, you have faith that we're going to get through this. And that is really, really important. No matter what, no matter how badly you feel about it, you gotta get forward and make sure you're given that positive reinforcement.
The captain needs to be on the ship, right?
Absolutely.
I look at it.
So how do you feel about having that responsibility?
I think we've always had it.
Yeah.
I think that is our,
We signed up for it. And you changed jobs in the middle of it, so you knew.
I know.
Yeah, but it's an incredible honor to serve the community and your coworkers. We all have our own roles, and back to the teamwork, like everybody, we all have to play our part. And a CEO has a part, just like the housekeeper has a part, just like the ambulance driver has a part, and we need to bring our A game, as we all do. And if we all do, we will continue to get through it.
Yeah, I agree, Laura.
Okay,